So it's critical that we partner with the psychological medicine team, really understand how our patients are going through this treatment, what their psychological status is, and whether there are particular therapies which are affecting them more, and learn by working with the psychological medicine team as how we can support our patients.
You can't really overestimate the impact of a cancer diagnosis. There'll be psychosocial aspects, how it affects their family, their work, and if it's a life-limiting diagnosis, if they're concerned that this may not be something that can be cured, that can be devastating.
The psychological medicine team here is fully integrated within the cancer center. They contact patients in advance and screen them to look for any issues with regards to psychological health, and they give clear guidelines to me and my patient as to how they're going to be managed based on how their current psychological health is. So what I find unique about the psychological medicine service in our cancer center is very much part of the integral clinical care that we provide for our patients.
Each session lasts about an hour, and we usually meet about every 2 weeks. So we're very much focused on the here and now. It's not just general talking, but we do try to sort of have something for you to go away and change.
We offer problem-solving therapy and we offer something called behavioural activation. The whole sort of USP of collaborative care is proactively screening every single patient, which ensures that everybody gets screened. We reach the hard-to-reach groups. And if they indicate that they're struggling with certain things, they then get a call from one of the team and we're able to offer treatment.
Working off the same electronic platform has been absolutely essential. They're able to see the considerations I have for my patient with regards to treatment or what elements of psychological concern I may have had. So they're able to have a very seamless conversation, also build an excellent rapport with my patients because they know who the patient has seen before in my clinical team, what type of conversation they've had, and also they're able to tell the patient that whatever conversations they're having will be immediately communicated via this platform to us.
It's completely revolutionised the way that I think of a psychiatric service because we work with them rather than them being a distant thing that I know nothing about. Having them here and knowing them and being able to approach them and the other way around, that is most valuable to me.
They're not seeing a haematology patient with anxiety and depression, they're seeing a person who happens to have those two things going on at the same time and deal with them on a level that's more human. That mirrors the approach that we have in general practice. When I have needed to contact them, they've been open-minded and willing to communicate in a timely way, because that's what you really need as a GP. If you're worried, you need to flag that and get some sort of feedback, and they've been very sort of amenable to that, so that's been helpful.
Part of the collaborative care model is being able to work with the GP. So all our sort of medication advice goes through the GP. The GP is informed about what is happening with the patient at every stage of their treatment. And then once the person's discharged from the cancer centre, they can follow things through.
A lot of the patients I refer are patients who have anxiety problems about coming in for treatment, and we can't effectively treat them because they're too scared to come in. So those are the people we're trying to cure, and the psychological medicine department helps us do that appropriately by supporting them with those symptoms. And then there are the other people who we can't cure, who are going to live for 5 years or 2 years or 3 months with cancer, and they need to learn how to manage the uncertainty of living with cancer. You can't plan for next year, you have to plan for tomorrow. And the psychology of dealing with that is very difficult.
So some people might be able to say, I'm very anxious about a particular thing, but other people find it harder to express that, but they can worry about their physical symptoms. So they tend to have more severe symptoms, so the pain could be magnified by the anxiety, and that in turn could lead to them coming to the emergency department or coming to triage. All of this can have knock-on effects on their ability to continue with their chemotherapy or their radiotherapy because they don't come in for their scans, they tend to delay their treatments. Being able to deal with anxiety, being able to deal with depression can in some ways make treatment so much easier.
Those patients who have received additional intervention from the psychological medicine team have had significant benefit and have been able to re-engage with their clinical care and derive therapeutic benefit from treatments which we may have struggled to give for them if we did not have the psychological medicine team at our centre. And that to me has been an absolute game changer for patients.
It's a very nice way of being able to see how somebody's progressing through their treatment, and if something is starting to become a problem, we pick up on that early and we know that we're able to provide them the best possible treatment.
Sometimes if you end up in a stage where you need pharmacotherapies, then you've got additional considerations as to how they would interact whilst patient is having their cancer treatments as well. So to try and diagnose these early and intervene early through behavioral practices and useful skills that they can learn from the psychology practitioners is helpful.
And being able to pick up on this and deal with it earlier on ensures that people are able to go back to their baseline level of functioning. So they're able to go back to work, they're able to go back to all the sort of job roles that they were performing before their cancer diagnosis. And that is a significant thing.
Knowing that there is an expert, there is a psychiatrist who can oversee the patient that needs that extra help and support is a huge reassurance, definitely.
I think once you have a psychological medicine service, it's quite hard to imagine practicing without one. I would now be quite upset if I had to move to centre without one, I guess is the only thing I can think to say.
From what I've seen firsthand in looking after my patients, this is something that as the NHS we should be investing more of in cancer centres.
3/4 of these patients with major depression don't get any treatment at all. And by doing this, we actually have completely gotten around that. So all our patients, they have an equal chance of being able to access treatment, which is timely, which is delivered by specialists. No one gets left behind by being able to do this.